Welcome to another short from the Vet Med Digest. Today, we condense the fascinating world of veterinary hemostasis and critical care, focusing on two specialized tools, desmopressin and cryoprecipitate. Desmopressin, a synthetic analog of vasopressin, is primarily known for its powerful effects in rapidly stimulating the release of key clotting proteins, specifically coagulation factor VIII and von Willebrand factor, from the endothelial cells lining blood vessels. This action makes it invaluable for managing or preventing hemorrhage in dogs suffering from inherited bleeding disorders like von Willebrand disease, particularly during surgical procedures. Interestingly, experimental data consistently show that dogs require a significantly higher dose of desmopressin to achieve the same clotting factor elevations seen in humans. Beyond immediate hemostasis, desmopressin has emerged as a promising tool in veterinary oncology. In bitches with locally advanced mammary carcinoma, perioperative administration of the drug significantly prolonged overall survival, especially in those with aggressive, high-grade tumors. This anti-metastatic effect is attributed both to the release of von Willebrand factor, which helps collapse micrometastatic lesions, and potentially to a direct antiproliferative effect on the tumor cells themselves. The mechanism by which desmopressin releases these clotting factors in the dog is considered adrenergic and can be temporarily suppressed by drugs like barbiturate anesthesia. In contrast, cryoprecipitate is a highly concentrated blood product. Produced by slowly thawing fresh frozen plasma, it is rich in factor VIII, von Willebrand factor, and fibrinogen. Because these factors are concentrated into a minimal volume, typically only 10 to 15 milliliters per unit, cryoprecipitate is the preferred therapeutic choice for canine inherited coagulopathies over fresh frozen plasma, as it minimizes the risk of fluid overload. Studies confirm that cryoprecipitate is highly effective and appears safer than fresh frozen plasma in treating dogs with hemophilia A and von Willebrand disease. Finally, we look at cryoporplasma, the byproduct left behind after cryoprecipitate is extracted. Once disregarded, studies show this component is highly useful. It contains a higher concentration of albumin and colloid osmotic pressure than fresh frozen plasma, making it an excellent, cost-effective alternative for treating hypoalbuminemia in critically ill dogs. Furthermore, cryoporplasma retains functionally similar levels of the vitamin K-dependent coagulation factors, factors 2, 7, and 10, compared to fresh frozen plasma, validating its use as an emergency treatment for long-acting anticoagulant rodenticide toxicity. Together, these specialized products represent targeted and efficient approaches to managing canine hemorrhage, critical illness, and even certain cancers. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.